This is Klahn's clinic on fetal insomnia. Fetal insomnia is classified as a prion disease, which is extremely rare and is caused by a misfolded protein leading to neurological degeneration. This is also known as a transmissible spongiform encephalopathy. I know this is kind of a lot, but don't worry, we'll get it through little by little. First of all, to understand the cause, you'll need a little biology lesson in protein synthesis. The process begins with DNA giving instructions in the form of RNA to create a certain protein. The RNA is then deciphered and tells amino acids to pair up to form a long chain, which then folds and forms to become a specific protein. The protein that we are looking at is PRPC, the normal cellular prion protein, coded by the PRNP gene. The function of this protein is still under speculation, but it is considered to be a part of cell signaling and transporting of ionic copper. The problems arise when the cellular prion protein becomes its abnormal variant, scrapie prion protein. These two proteins are exactly the same, chemically that is, but the folding is different. The H1 alpha helix instead becomes a beta sheet. And if you can recall from any biology or anatomy class, shape equals function. And because we have now changed the shape of PRPC, we have changed the function. What was once a necessary protein is now a toxic substance to our cells. PRPSC starts to accumulate in the thalamus, responsible for regulating sleep, body temperature, appetite, and other autonomous functions. The abnormal protein begins to kill off cells in the thalamus, creating holes in the tissue, giving it its spongy look. But why does a protein misfold like this? Unfortunately, that is also pretty much unknown. However, there are multiple ways that a person can acquire misfolding of the PRPC. Mutations on the PRNP gene at codon 178 changes the amino acid sequence from aspartic acid to asparagine. This point mutation makes a person far more susceptible to misfolding these proteins naturally. People with this form of the disease suffer from fatal familial insomnia. Familial because it can be inherited. Or the person could suffer from the other form, sporadic fatal insomnia, which causes the proteins to misfold without a mutation on the PRNP gene. Both versions act the same because in the end the thalamus is still being damaged. But how would they know that you suffer from fatal insomnia? Diagnosis can prove difficult. It can be overlooked or misdiagnosed due to its rarity and the symptoms that it shares with other conditions. After all, the disease only affects about 50 families worldwide, and even fewer have the sporadic form. In addition to that, there won't be any signs of infection until the person is around 50 years old. But disregarding all that, people with the genetic variant will be diagnosed using molecular genetic testing. This test only analyzes one gene, which in our case is PRNP. Obviously, that test will be negative for the sporadic form, so they will undergo further testing. A polysomnography, or a sleep study, will measure vital signs of brain waves and take note of any body and eye movements during the duration of REM and non-REM sleep. A positron emission tomography will use radio tracers to view the brain's metabolism, specifically in the thalamus. And because the thalamus is damaged and missing tissue, it should display a low reading due to the reduced amount of activity. Now, knowing all this is great and all, but what happens to someone with this fatal insomnia? Well, once damage is significant enough, the symptoms begin and the disease progression starts to move quickly. In the first 4 months, the patient will acquire mild insomnia, which will then continue to get worse as time goes on. Toward the end of the stage, they will experience panic attacks, paranoia, and develop phobias. The next 5 months cause the previous symptoms to increase in severity, and hallucinations start to come into play. Within the next 3 months, the person is unable to sleep. When trying to sleep, they can only enter the hypnagogic state, the transitional stage from being awake to being asleep. If they do manage to enter the sleep cycle, it will be irregular. The REM and non-REM sleep will be hard to distinguish and the brain will become too active. So when they awake, the sleep will not have refreshed them at all. Also, from the body being so active, the patient will have unintentional weight loss and may become pre-diabetic. From sleep deprivation and a damaged thalamus, fever, tachycardia, hypertension, uncoordinated movements, tremors, and vision problems are likely. The next 6 months bring on dementia and worsening of other symptoms. It is only a matter of time until the patient slips into coma and dies. Well, can't we do anything to help them? Yes and no. A person can take melatonin to assist in falling asleep, or sleep can be induced through sedatives, but when tried on a fatal insomniac, the medications prove ineffective or even harmful by speeding up the disease's progression. There have been tests where patients have been forced to sleep by using strong sedatives, and when they awoke, they seemed fine. For a couple of weeks, and then the disease progressed and eventually led to their death. Therefore, treatment is only used to lessen the patient's symptoms as the disease runs its course. But why do they die even if they get to sleep? Sleep deprivation is secondary to the cause of death. The actual cause is considered to be the breakdown of the sympathetic nervous system due to damage within the thalamus. The sympathetic nervous system is a part of the autonomic nervous system, which controls a lot of the most important functions in the body that you aren't consciously in control of. For now, this process is unavoidable, which truly does put the fatal in fatal insomnia. In conclusion, all-nighters should be limited to 1 day, not 6 months. That's all I have for this video. I had a lot of fun making this one, despite being a pretty dark topic. It was fun diving into the biochem and story-like progression of the disease. It was really interesting to me, and I hope it was interesting to you as well. Now, for the end stuff. Subscribe to me on YouTube, DTube, or follow me on Twitter. Again, I have no cute videos, so we will have another surprise in store for you next time. But until then, stay healthy and be safe.